Pandemic, think again. The U.S. today set a record for infections, 39,000 in a single day. Cases rising in 29 states. Now the frontline warriors overseeing this new onslaught of the coronavirus.
The patients that we are transporting are some of the sickest of the sick COVID patients that are out there. There's always an element of a higher level of care. There's always an element of a time factor.
Texas breaking a record, reporting more than 5,000 new cases.
Numbers here in California are skyrocketing.
Florida's Department of Health reporting a worrisome increase in the rate of positive tests.
It's like stepping back in time. Crisis we hoped was fading once again in clear focus.
We may be tired of the virus, but as someone said, the virus is not tired of us.
COVID-19 cases now on the rise in at least 29 states. Hospitalizations up in 23 as public health officials struggle to control the sudden surges.
We assume COVID until proven otherwise.
None of us want to be the epicenter of focus.
And in the last 24 hours, nearly 39,000 new cases in the U.S. The CDC warning the actual numbers may be 10 times higher than reported, predicting up to 150,000 deaths by July 18th. In Florida, long lines for testing as cases there soar. California shattering records. LA County now the highest infection rate in the nation. And in Texas, the governor calling the outbreak there massive, today hitting the pause button on the state's reopening. Officials now calling out complacency and non-compliance as they race against time to limit the spread.
We are getting pandemic fatigue, but we do not necessarily have states that are operating with sort of evidence-based decisions, and so they're getting mixed messages.
Tonight, frontline workers taking us inside, describing the change in face of the COVID surge. Young people.
We're seeing much more less than 50-year-old, 25-year-old, 30-year-old, and they are being admitted.
Anyone who believes that this disease is not real, it's definitely real, it's no joke.
Just 3 weeks ago, Houston resident Shimon Lamara thought the worst of COVID-19 was in the rearview mirror. And like many in her city, went out after the city reopened for a girls' night and birthday party with friends. Were you and your friends at all concerned about going out in public to bars, restaurants, packed spaces?
Oh, of course. Like we were definitely concerned, but we were trying to be as safe as possible. So the restaurants we went to, they had everything, the tables separated to where social distancing. So it was just 6 of us at the table.
So you thought, based on the rules of the time, that you guys were fine?
Right. Exactly.
We don't get it. A few days later, she attended one of the George Floyd protests in support of Black Lives Matter. The very next day, you developed symptoms. Did you think it was COVID?
No. I was like, oh, maybe this is a summer flu or just a little bug or something. But as the day went on and I got more sicker and more symptoms started to come in, I realized that it may possibly be COVID. The first 3 days, I literally did not leave the bed. I didn't eat. The body aches were the worst. Like I was literally like walking hunched over because I was in so much pain. My body I was freezing cold, but my body was hot and I had chills.
Now she's using her story as a cautionary tale.
I literally have been telling my friends, like, if y'all want me to come somewhere, I need to see y'all current and negative COVID test results because y'all don't want to go through what I've been through. If you don't wear the mask, it's consequences you're going to have to take up, maybe possibly losing your life.
Despite continuing to be a point of contention for some, a new study suggested if the majority of Americans wore masks, it could save 33,000 lives through the fall.
In the last 2 to 3 weeks, what we have noticed in this state, in this city, I am reporting cases 6, 7, 8, 900, in one case over 1,000 cases in a day.
Mayor Sylvester Turner saying, while the death rate remains low compared to other cities, Houston must step up and clamp down to combat the rising tide.
That's what has occurred when you're bringing people back together, when you're not following the proper procedures, people not wearing their masks, they're not engaged in social distancing, they're not exercising proper hygiene. We fell off the horse, and now we got to get back on the horse.
Yesterday, Mayor Turner warning businesses to monitor their crowd flow.
We are looking at creating what I would call a board of shame
and identifying those businesses that are really working against the rules.
When you ignore the social distancing and you come together, you are fueling this virus. When you're walking around and you're not putting on your mask, when you're not engaged in proper hygiene, you are fueling the virus. It never went away. It was never gone in the city of Houston.
We had gone through a lull of not making very many COVIDs, it seemed like, and now we're making more COVIDs on a daily basis.
Daniel Soto is a supervising captain with the Houston Fire Department. He spoke with my colleague, Tom Yamas.
So you're talking about doing CPR on somebody that has COVID. What's going through your mind?
Well, we suspect everyone has COVID. Especially if we can't speak to them or ask them what kind of symptoms they have. If they are in arrest and you need to get down and do CPR to save their life. Today I've made 2 runs. The first one was a cardiac arrest. A young man who needed CPR and potential COVID. So we don't know for sure if he had COVID, but the family had said that he had a cough for several days as well as body fatigue. Definitely on the lookout.
The young lady,
She's 35.
she's all young.
All young.
Really, 35 is
35
young.
years
They're
old.
all babies, you know.
At Houston Methodist, one of the largest hospitals in the city, doctors have been surprised by the change in the patient population. The first surge they saw this spring.
It is really mind-boggling. These people don't get admitted, and they were otherwise healthy.
Dr. Faisal Massoud is the medical director of critical care.
These are healthy individuals who, if they had followed all the social distancing and masks, they would never be in the hospital.
Lungs don't look great. Eric still wants us to push for extubation since she's young. I don't think...
Nursing director Teal Riley, a 22-year veteran, says she's also seeing another disturbing trend.
We're seeing families, so it's not just a husband, who's ill and the spouse is at home. We're seeing a husband, the spouse, the sisters, the whole family is being coming up positive with the COVID.
You're seeing entire families test positive
that
and now
is
we're
correct.
in the hospital.
Yes, that is correct.
And what hurts the most, Riley says, is that so many of these infections may have been preventable.
The hardest part is just the compliance of the community, and they're just not getting it. I ask anybody to come walk in my shoes for one day and just see what I see. When you have a patient in the critical care, and unfortunately when they don't survive, knowing that we did everything we possibly could to restore their... Okay, you're going to make me cry now. No, I have a hard time talking. This is the hardest part about the whole thing. I'm sorry. We're so used to comforting and having the families at the bedside and just giving them that additional support that they need, and just not being able to do that or have them there with the patient. It's hard. So we've become part of their family to make sure that their loved one is dying peacefully and getting through this.
Coming up, how a difficult talk on race and racism sparked a movement to listen and lift up our neighbors.